In Malawi, nearly 12% of people aged between 15 and 49 are living with HIV/AIDS. Over 60,000 people die from the disease each year. In Chiradzulu district, in the south of the country, nearly 1 in 7 people are infected with the virus. The extent of the need and the shortage of healthcare workers has prompted Médecins Sans Frontières to develop new approaches to case management. This programme was set up to provide access to care and to anti-retroviral treatment, not only in the hospital, but in all the health centres in the district.
Have you had any problems with the new treatment?
No, my appetite is better now.
It's good to have an appetite. Eating more will help your body to function properly. You see this medication?
Yes, they're the ones I finished.
You take 2 in the morning, 2 in the evening, and after a month, when you finish the first box, you start the other one.
But I take them at the same time?
Yes. What time do you take them?
At 9 o'clock.
So you take them at 9 o'clock in the morning and 9 o'clock in the evening.
Yes, I understand.
L'objectif de décentraliser les soins VIH.
Our objective in decentralizing HIV care and moving it out into the health centers is to provide the care closer to home, so that patients don't have to travel long distances to the hospital. It's also to provide better follow-up, because the closer the medical team, the quicker and easier it is for patients to go to the clinic if there are complications or if they're not feeling well.
Your next appointment is on June 11th.
June 11th.
But if you have any problems, you must come and see us before that.
Numa was admitted to the MSF programme in 2008. He was already on ARVs. He was recently put on second-line treatment as he had developed resistance to the first-line drugs.
When I first started the drugs, I got a rash. I was put on a new treatment, and since then, I feel better. It was complicated being treated in a district hospital. I have trouble walking, and I don't have a bicycle or anything. It was also a problem finding money for transport because it's far away. It takes me 30 minutes to get to the health center from my home. At first, I came twice a month, but now that I'm doing better, my next appointment is in 2 months.
Today, MSF, together with the help of district health authorities, is operating in all the health centers in the district of Chiradzulu. In practice, this means that MSF and Ministry of Health medical staff are collaborating on a daily basis, and the tasks are being shared between them.
Berta is a nurse. She's with Solange, a 26-year-old patient who was admitted to the programme in 2003. Her condition remains stable, so she'll continue her first-line antiretroviral treatment.
I'm going to draw some blood to check your CD4 count. You need to come back and see me in 2 weeks, on the 25th, to get the results.
Solange is doing her annual blood test. It will be used to measure her CD4 count in order to assess the state of her immune system. The blood samples are transported by MSF cars from the health centres to the Chiradzulu District Hospital for analysis. MSF also takes charge of transferring any patients requiring additional tests or who need to be hospitalised. Blood samples have to be centrifuged within 4 hours, a process that is carried out in the hospital laboratory. MSF has been working in the district hospital for over 10 years and introduced antiretroviral therapy to the programme in August 2001. The teams also treat opportunistic diseases associated with HIV/AIDS, such as tuberculosis.
When patients are first put on ARVs, MSF focuses a lot of time and attention on helping the patient to accept this lifelong treatment. To achieve that, a team of counselors was set up to work in tandem with the medical team, allowing patients to talk about the day-to-day problems they face in complying with their anti-retroviral treatment. MSF has also developed a special approach to treating children. We've elaborated communication tools to be used with children between the ages of 7 and 14 who have not yet been informed that they have the virus, so that they can gradually learn they have a virus, which unfortunately will be with them for the rest of their lives.
And we have seen that it's important to start talking about their status while they are young, like starting from 6 years and above. Most of the children, those who don't know their status until they are 14 years and 15 years, they have difficulties in taking the drug. And maybe if the child is switched to second line, maybe because of treatment failure, and the child didn't know what she has in blood, and now she's switched to second line, she will not understand it. It's like she's depressed. So we have a lot to say. We have a lot to do.
How are you feeling with the drugs?
I feel better.
Better in what way?
It's very different from how I was before.
How were you feeling before?
I was sick most of the time.
At school, do people know that you take ARVs?
No, nobody knows. I haven't told anyone.
Do you know why you were taking the drugs?
Yes, because of the disease.
To prevent the virus from progressing.
Yes, that way the virus will not come.
The virus will not come? Or the virus will be there, but it will be weak? The virus won't become strong.
Children represent over 10% of the patients receiving care in health centres in Chiratsulu district. Over 13,000 patients are currently on antiretroviral treatment. However, providing quality care to an ever-increasing number of patients has been a real challenge due to the severe shortage of qualified health staff in Malawi. There are virtually no doctors at all, and not enough clinical officers, who have 4 years of medical training, to handle the workload.
Malawi
has been quite proactive in transferring certain medical responsibilities to nurses, nurses being present in most of the country's health centers. In practice, this has meant training nursing staff, so that now, when a patient tests positive at a health center, in Chiratsulu, for example, they will not necessarily be seen by a clinical officer. They could be seen by a nurse who will be able to assess their condition and provide them with access to ARV treatment if required.
Since we started this task shifting to nurses, so I see new patients and I initiate ART to new patients and I follow them up and I see all those stable patients. And we treat also some of them opportunistic infections and all sorts of things. When it's something that is beyond me, difficult for me, and then I refer to the clinical officer.
The practice of task shifting, usually reserved for senior health professionals to lower level professionals, or in some cases to non-professionals, is widespread in developing countries. It is a way of addressing the lack of human resources and improving patient care. In Malawi, it involves not only nurses, but also clinical officers and medical assistants who have received training and support in starting patients on ARV treatment and ensuring follow-up. Screening and psychosocial and nutritional support can be provided by trained, non-specialist personnel. Although task shifting makes quality care more readily available, it does have its limits.
Every month we put between 300 and 350 new patients on antiretroviral therapy, a clear indication of how enormous the needs still are.
The number of patients continues to rise and human resources remain limited despite the different initiatives taken. British development funds finance the training of 1,000 new students each year, but the benefits of this emergency plan will not be in effect until 2010, when the first cycle of training will be complete. Also, with a view to alleviating the workload of medical staff, and because therapeutic advances have made it possible, stable patients who have complied with treatment for at least 1 year are given the option of spacing out their regular checkups.
I've looked at your medical file and I see that you haven't had any problems. Your treatment is going well, so I'd like to offer you the choice of joining the 6-month appointment program. Do you know what that is?
Yes, it's a program for stable patients where you have a medical appointment with the nurse or medical assistant every 6 months. You just come back every 3 months to get your antiretroviral treatment.
Yes, that's right. But you do know that in the meantime, if you have a problem at home, if you're sick, you must come here. Don't wait until your appointment.
The criteria are just many. For example, we recruit all the patients who are on the first-line treatment, first criteria. Secondly, these patients have to be on ARVs more than 1 year. They have got a CD4 of more than 350. And if they are women, they should not be pregnant. And these, they should be very adherent to the treatment. They've consulted the counselor, and they really know what they are doing. We are trying to empower the patients that they should look after themselves at home.
Of the 13,000 patients receiving antiretroviral therapy on the programme, 740 are now on the 6-month appointment schedule. Although such strategies provide some relief for healthcare staff and allow new patients to enter our programmes and receive care quickly, they are not in place throughout the country. In Malawi, only half of the patients who require antiretroviral treatment have access to it.
Même si demain toute la population peut se faire tester,
Even if it were possible for the whole population to be tested tomorrow, the Ministry of Health would still face the same limitations in terms of human resources. This limits what we are able to do as well. We can't hire many people because we also have our own financial and logistical limitations. So we try to provide as much training as possible to MSF teams so that the nurses and clinical officers can treat the most serious cases. Generally, this enables us to leave the more straightforward cases for the Ministry of Health.
De pouvoir normalement dégager les cas légers au ministère de la Santé, mais ça veut dire aussi qu'il
But that also means the Ministry of Health staff need to be trained on AIDS case management in order to treat, follow up, and to be kept up to date on the pathology.
Today, the decentralization process is complete, which in a way has been MSF's primary objective since 2005. And now we're in a new phase. As care is now accessible in most parts of the district, we're thinking more about the long term. And obviously, this includes the possibility of handing over MSF activities in the district.
The handover of certain aspects of the programme will take several years to complete. And to achieve this, MSF will need to work closely with both the Ministry of Health and other partners to increase the Ministry's capacity to provide care to these patients. In the meantime, Médecins Sans Frontières must continue to develop activities such as the prevention of mother-to-child HIV transmission, paediatric care, and detecting treatment failure.